Now, out-of-pocket surgery costs can run into the tens of thousands of dollars, and the wait in the public system is often too long for many people who need help urgently. But now there's hope. Tonight, the program offering cut-price treatments to those who need them most.
So this is the loose skin we're taking off. Good morning, thank you.
Life-changing surgery.
They've changed my life, they've saved my life.
At a fraction of the normal price.
It's about a tenth of the price that you would normally pay.
And it's not too good to be true.
I probably saved close to $15,000.
Father of one, Bill Gibson, tipped the scales at 154 kilograms at his heaviest. Today, 10 months after a gastric bypass, he's a new man, 60 kilos lighter.
Why did you decide that you needed to lose the weight?
I have a son who's now 8 years old, and as he got older and more active, I found myself struggling to try and keep up with him. If I'd kept up the way I was going, who knows? You know, I might not be here to see his 10th birthday.
Bill?
When Bill first met surgeon Dr. Jason Marnie, he was suffering from a long list of health issues linked to obesity.
He had type 2 diabetes and he was on tablets and insulin. He had obstructive sleep apnea and hypertension, as well as significant back pain.
Dr. Marnie performed the weight loss surgery through the Access program, so Bill paid less than half of what his wife was charged for the same procedure a few years earlier.
It was a really significant saving, and we would not have been able to afford to have my surgery done without the Access program.
Well, the Access program essentially targets people that are underinsured.
Professor Anand Deva established the Access program with the help of Macquarie University to help address creeping out-of-pocket costs in the private health system.
So Access tries to open the door to these patients and says that if you're a patient that really needs a procedure but are truly financially stressed and can't afford it, for whatever reason, then we want to help you.
Previously, half of all Australians held private cover, but in recent years that figure has dropped to 46%.
While health funds fully cover you when you're in hospital, in some cases, in about a third of cases, people will need to pay a gap. And in a small number of cases, about 7%, that gap is very large.
Dr. Rachel David from Private Healthcare Australia blames rising costs and an ageing population for the decline.
Anything that can be done to give people certainty about what their out-of-pocket is and to keep it as low as possible is a good idea.
Professor Deva is one of about 30 surgeons across Australia offering huge discounts and fixed fees on life-changing surgeries, which are only available through the private system.
To commit to doing 1 or 2 cases a month through the Access program is really not going to cost, you as a doctor too much. But you get paid in other ways. These are amongst the most grateful patients I've had the privilege of treating in my career.
Since Access was launched in 2017, hundreds of patients have reaped the benefits. And as more surgeons come on board, the scheme has now been extended from body contouring surgeries to also include bariatrics and orthopaedics, including hip and knee replacements.
So for a weight loss procedure, for example, which I offer, the maximum a patient will pay is $500 per procedure.
Breast reduction surgery is also available for patients like Ashley Lau. Can I ask what size you were?
I was a 10 double H, and then I've gone to obviously a 10D to a double D. So it's a big change, a few cups down.
You know, you'll be a different person this summer.
I will. I won't have to hide.
Yeah.
Having had the procedure herself, Ashley's mum Kylie encouraged her daughter to apply through the Access website.
With Ashley's age and obviously her employment, she was only working part-time to get those funds to do it privately, just really wasn't a realistic option.
Dr. Anthony Barker operated on Ashley earlier this year.
It's very difficult to do this surgery through the public system, if not impossible at most public hospitals now. So people who can qualify for Access, it's a fantastic option for them.
Potential patients can apply for the Access program via its website. They must meet certain financial and health criteria. For people like Bill, it's been a lifeline.
Are you keeping up with your son?
Oh, absolutely. It's really taken me from isolation at home and put me back into the world again.
And there's more on the Access program on our website, and a reminder that all surgery carries risk. Your GP should always be the first port of call when considering any sort of medical procedure.